If you want to know how to get a high score in your OET speaking test, you've come to the right place. Ensure that you start the role play. Don't wait for the interlocutor to start. It is your job to take control and start the conversation yourself. Introduce yourself and call the patient by their name. If you're not sure which name to use, you can simply ask your interlocutor before the role play begins. And then you can start with the first bullet point and get straight on going through the tasks on the role card. You've got to make sure that you ask a mix of open and closed questions, so using these types of questions appropriately. Open questions encourage detailed responses, so this is used for gathering comprehensive information from your patient. Whereas closed questions elicit short, specific answers, use of sequencing language to explain procedures or give information, and making sure that you're organizing information logically and coherently in a way that the patient or caregiver can easily understand. Regularly check the patient or caregiver has understood, and pausing to check understanding before you move on. Make sure that throughout your role play you're using layperson's terms. What does this mean exactly? Basically, it means that you explain medical vocabulary in a way the patient or caregiver can understand. Remember, they are not a medical professional, so they're not going to understand all of the complex terms that you might have on your role card. So it's very important that you're explaining these terms in a way they can understand.